So hi guys, it's Dr. Ron Miller from cashbasedphysiotherapy.org, and today we're going over a Facebook strategy for the cash-based physiotherapy practice. So right now it's May 2017, so Facebook constantly changes their algorithm. So what I go over today may not apply by the fall. So right now it's May 2017, and let's go over my Facebook strategy. So everyone's talking about Facebook marketing and spending money on ads and reaching your niche market audience and stuff like that, but I'm going to show you exactly what's the best thing to do for Facebook. So let's just look at 5 different ways that you can market on Facebook. So the first one I just put was pretty much likes. So pretty much Facebook changed their algorithm late last year that the value of the like doesn't mean anything anymore. So if you have your business page, okay, if you notice, say for example, if 500 people liked your physiotherapy business page and you post content on there, notice that only like 20 or 30 people get it. So Facebook learned how to start making money. And they did this by they incentivized business owners or people who have businesses and Facebook pages to pay to reach our target audience. Now it's perfectly fine for your personal Facebook page. You don't have to do that for that. But for your business page, you have to boost content now to reach all of your target audience. And as a physiotherapist, you know, we treat multiple different body parts. We treat all sorts of different diagnoses. We reach out to all sorts of types of niche market groups. So it's really hard for us to post one post and then have it just spread like wildfire. So I use this example for my, a lot of times whenever I give a lecture. I saw this Facebook video from Golf Now that highlighted David Faraday putting a tee in his mouth and putting a golf ball in it and having John Daly just grip it and rip it right off of his mouth, which is absolutely insane. That video gets millions of shares, millions of views. But if you post a Facebook video going over the key concepts of treating shoulder pain without needing injections or surgeries, you won't get too many likes or shares with that. Just face it, it's not a cool topic to like your Facebook page. So the value of the like is pretty much shot and gone. So that's why it gets the big no. Don't even worry about likes anymore. So the second way to do things is going to be just posting to your page and then boosting it, okay? Now it's 2017, there's more effective ways of doing that. So I actually don't recommend you to just post to your page and just boost it to your local audience, because only the people who liked your page will probably end up getting it. Now you can boost it for more money to just share it with people, but there's better ways of doing this now. So this second one actually gets I wouldn't recommend just boosting your content to reach people because it has no call to action or you're not capturing any information with this. So I actually don't recommend the top 2 things that most people are actually doing. So don't waste your money on just boosting a post. Now, the third thing, which is probably the most popular thing going on right now, is doing an ads campaign. And this is done through the Power Editor or the Ads Manager, where you can actually create your own ad and target your specific niche market from finance, likes, habits, everything, and you can market directly to them. Now the key is you're not just going to directly market to them. You have to, identify your niche market, who you specifically want to target. So for example, don't pick low back pain. Pick runners with low back pain, firefighters with low back pain, people who sit as secretaries, receptionists, etc. Identify clearly your niche market. It could be finance, it could be likes, it could be CrossFit, anything, runners. Clearly define your niche market, create an ad campaign, and then you have to drop them into a funnel system to capture them. People aren't going to take or make a decision off of one instant, off of a Facebook ad. So you have to be able to capture their information and really focus on education here. Now the only problem that I have with the ads campaign is you're going to have to spend some money with this, and this is going into how much are you willing to spend to get one new patient off of this marketing campaign. There's people out there spending tens of thousands of dollars a day on Facebook marketing, generating millions of dollars of revenue. So not only is it going to cost you a lot more money, especially if this is not working, you're not going to get any return on your investment. So this is not just, I'm going to create an ad campaign, just launch it to my group. You have to have set processes throughout the whole step to make sure it works. And the most important thing is that if this is going to cost you a lot of money, you better be getting a return on your investment with this. So for example, if you spend $1,000 on an ad campaign over 1 to 2 weeks, by the end of the month or two, can you generate $5,000 of revenue from that? That's the key with this one. You know, it's not just launching an ad campaign. It's can your ad campaign and the money you spend with it get people to take action, call, become patients, and commit to your system, and you get a return on your investment with that. So this one is proven to work. It just costs a lot of money. So yes, you can implement it. If it's done right, you can make it work and make it work great for you. This is something that you may not even know, retargeting. So Facebook is so advanced now that you can get a pixel code. You know, you can design, say for instance, I want to target people with hip pain, okay? You can retarget them, and this is some awesome stuff. Facebook will give you a pixel code. You can go onto your website that is outside of Facebook and put that pixel code on all your hip pain pages in your website. It will gather the data over 1 to 3 months and track the people that are dropping on your hip pain pages with this code. And at the end of the month or two, then you have a gathering of data of people who were all looking for hip pain, and guess what your ad campaign is going to be? How to solve the hip pain. So then you create a specific ad campaign just to that small group of people. You know, it may be 90, it may be 100, maybe 200, but these are all people that were on your website looking at the hip pain pages, so obviously they had hip pain. This number 3 campaign could be tens of thousands of people around your local area who you're going to target. Could be 100,000 people. Versus this retargeting one, you're attracting people who were on your initial website looking for hip pain. And now your number may be 50, 60, maybe 90, maybe 100, 200, depends. And then you drop a hip pain campaign right on them via Facebook. It's going to cost you some money, but not as much as here. And then you design your funnel, and then at the end, you get your return on investment. So this is another way to use Facebook. This is a great way to use Facebook. You know, you may not be reaching tens of thousands or 100,000 people, but you're targeting yourself in front of 90 people who are on your website looking for hip pain or whatever type of diagnosis that you want. But this one, yes, this will cost some money. And again, the most important thing when it all comes down to it is, if you spend $100 here, are you getting $1,000 back? So what's your return on your investment? So number 5, this is what some people, this is my favorite thing to do. It costs absolutely nothing except some time, and you're just posting great content. And I wasn't even going to put this in there because this is a, you know, in the clinic when you're treating patients, you have clinical pearls. This is a marketing pearl, okay? You create a closed Facebook group, okay? You identify your niche market, runners, CrossFitters, whatever you want to do, pelvic floor, women, labor and pregnancy pains, low back pain, anything. Your niche market. You create a closed Facebook group and reach out to your local market and get them to invite them to the local group. This is the best thing to do because I think it's free. Doesn't cost you anything except time. You're putting content out there to all these people that are interested in your group, and they can interact, they can ask questions, they can comment, they can post, they can go to the search column, and you don't have to answer the same question over and over again. They can just search and all the past history and content will pop right up. This is a great thing to do. This is my favorite thing to do with Facebook. It's free. You can establish yourself as the expert. You can post content weekly. It's free. Patients or prospective patients engage. You can get past patients to join groups. You can invite friends and that invite more friends to the group as long as you're posting great quality content. This is a must. So that's my kind of marketing pearl with Facebook, is create a closed Facebook group to target your niche market. So I hope this clears up how a cash-based physical therapy practice can market on Facebook. Stay tuned to more. I'm going to start making a lot of great content coming up. I got a whiteboard and I got my whole video room set up so I can start making some great content again as I grow my practice, and I can help teach you guys how to not make the same mistakes I made and really help your practices out. So don't forget to like the Facebook page. Don't forget to like the YouTube channel. It's all free content. If you're not a member of the 101 forum, please send an invite. Guess what that is? That's a closed Facebook group. So you can write content. You know, it's a great community with other cash-based clinics, and we can problem solve together. So thanks again for tuning in. If you're not subscribed to the email list, go to cashbasedphysicaltherapy.org. And thank you for your time, and I hope that you learned something about Facebook.